It's time now for Health Specialist Leah Sarich, and we're talking today about something that, well, if you're having trouble in bed, men, if you're feeling tired, gaining weight, you could be suffering from low testosterone. And Leah's here to tell us, I guess, kind of the symptoms and what can be done about it, too, right?
And really how common it is, because this is what I found really shocking when I read about this story. Up to 40% of men over the age of 45 could be suffering from this. So that's really quite common. Yeah, that's a big deal. It's right across the board. So basically, we all know testosterone, known as the sex hormone. It's definitely involved in controlling sexual function, but it also plays a major role in things like muscle, bone, and heart health.
Oh.
Yeah, so it's a pretty useful hormone for sure. And as men age, their testosterone levels tend to go down, but for some men, these levels go down much quicker than they need to. So this is when you start feeling symptomatic. And I spoke to urologist Dr. Jay Lee about this, and he really talks about what the symptoms are and what they're going to look like in these men.
A lot of times it's their wives that will bring them in, saying my husband is now slow and grumpy and doesn't want to do anything anymore and has lost interest in everything. So it's very common to symptoms of depression or low thyroid, but these men say their life just feels different, that they feel 20 years older than they really are. So they'll complain of sexual difficulties, again, most commonly, but again, they'll gain weight. They'll say that at 2 o'clock in the afternoon, they have to have a nap all the time, and they just say they have no energy to do anything.
So those are pretty dramatic symptoms.
Yeah,
you can
no
imagine if that's overtaking your life for sure. But the good news here is that it's a simple blood test to find out if you're affected by this. So you just need to go get a simple blood test done, and they'll actually be able to tell you right then and there, yes or no, if your testosterone is too low. And then if it is too low, treatments are really quite simple.
Oh, okay. Yeah. And like, what are the treatments? Is it just medication, or is it a combination of things?
So there's a few different options. Dr. Lee says there are injections, patches, pills, but his favorite thing is actually a gel, and he says the gel works best.
The most common thing we use is a topical gel. It's just a gel that you apply to your shoulders every day. The benefit of the gel is that it absorbs quickly and that your levels go right back to where they're supposed to be. So we're not trying to give men super doses of steroids. So you're not going to become a weightlifter or this big bulky guy. We're just trying to get you back to where you're supposed to be.
Exactly. So it's not like you're going to become this person that, like somebody that you weren't before, but you're just going to get back to where you should be so that you're feeling normal and comfortable. So the other thing I do want to mention is there is a subgroup of people that really should consider getting tested even if they're not symptomatic.
Okay.
So these are people who are overweight, who are suffering from chronic pain and are on chronic pain medications, or those who have diabetes. That group of men actually has a 50% chance of having low testosterone. And they may not even realize that they're symptomatic. So that group should really just get tested at their annual physical for sure.
Okay,
yeah.
and so that's the best place to go? You chat with your doctor about it?
Sure, absolutely. Start there. Start with your family doctor and just say, this is kind of how I'm feeling. I heard something about low testosterone. Should we get that checked? And as a rule, they're not going to check it unless you're symptomatic, unless you're in that subgroup that I just mentioned.
Okay.
But again, it's a very simple treatment. Now, the only trick with the treatment is that if you do, in fact, have low testosterone, it's all of a sudden not going to start producing again. Your testicles aren't going to say, okay, let's start producing testosterone again. You will have to stay on that treatment for the rest of your life.
I see. It's just kind of, that's the way they go.
That's just how it goes, but you're going to feel much better. So definitely look into that treatment if you're symptomatic.
All right, good stuff. And if you didn't catch all that information, you're going to post it on your blog,
You bet.
right?
It's all on my blog.
Good stuff. Looking forward to that. Okay.